This conference will now be recorded.
Okay, back on track. Here we go. Okay. So nail diseases, disorders, and conditions. Here we go. So we're getting into the fun stuff. So onychosis is a disease, disorder, or condition of the nail. So etiology is the cause of the disease. So when we talk about the term onychosis, we're talking about the disease specifically, and etiology could be anything that's causing that condition. So, those causes might be, like this says, systemic, environmental, or disease related. It could be due to anything, pretty much anything that causes it. All right. So the 6 signs of infection. This is a good thing to remember, not just for your state board, but also just in life. Signs of infection do include pain, swelling, redness, local fever, throbbing, and pus. So for those of you who don't know what local fever means, local means in and around the place of injury. So if you felt your injury and it feels really hot to the touch, that's what that means. Yeah, pus. Pus is never a good sign. All right, so the temperature of the skin. If your skin is cold and you're noticing signs of infection, that's due to poor circulation. That's also scary. You have to go to the hospital. Hot may indicate that you have a raging infection in there, but at least you do have circulation going. The texture of your skin could change depending on which disease or disorder you have. And then inflammation on skin or nails indicates visible injuries and poor circulation. All right, so let's look at a couple of those. Yeah, length and condition, tenderness or stiff joints, nail plate shape and thickness, all of these things could be signs. All right, here we go into the fun stuff. And then I get to have a lot of fun pronouncing every single one of these. It's always a good time. All right, so we have tinea, unguium, or just tinea. How about that? Ringworm on the nail. So tinea on your nail, it does look like a fungus because it is a fungus. So this can be really hard to actually even diagnose. Of course, we don't diagnose anybody because we are not physicians. If one of your clients walked in and they had toenails that looked like this, we know that it's probably a fungus, but we can't say that. So something to remember, we can never look at somebody and say, you have a fungus or you have this. We're allowed to say, I suspect that you have one, and then we need to refer them to a physician. You always want to follow up with, but you need to go see your doctor. I suspect that you could have this, but you need to go see a doctor. I'm not a doctor. Okay. Always be careful about how you say that. So here we go. Ringworm, like I said, it is a fungus. Now, when you have a fungus on the nail, the nails, it's a little bit hard to see. I feel like this is a little further away, but I'll show you guys a couple more pictures. The nail actually turns into almost like a sandy texture. So if your client came in and their nails were just totally covered in fungus, they're typically either going to be like they look white and chalky or yellow and chalky. If you were to try to cut them or file them down, it's like the nail starts reacting like sand. I don't know if you guys have ever come across that before, but it is pretty intense, pretty intense. And it is contagious, so do not touch it. Really don't touch it, or if you're going to, you got to have gloves on. And by I mean, touch it, I mean we're not moving forward with service, but if for whatever reason you had just had to get your hands in there, please put gloves on. All right, so if a client walked in and they had this on their hands or their feet, we would not be able to perform a service on them. We just can't. Yeah, so thick, discolored, that's the other thing. When you have a fungus on the nails, they get thicker. Yeah, definitely. Oh my gosh, oh my gosh, oh my gosh, stop, stop, stop. Make it stop. Okay. And then ringworm on the hand. You'll notice that it looks a little different, but we still have that chalkiness happening. This could also end up being more of like a yellowy situation as well. So typically though on the hands, it will look like that. It just chalky. Appears as rings containing tiny blisters, dark pink or reddish in color, can have dry flakes, can be confused with eczema or contact dermatitis. So there are a lot of other things that this actually looks like. Another reason why it's so important for us not to actually tell any of our clients that they have a certain something, because we don't know for sure. They gotta go get diagnosed. But if any of your clients appear to have this, we can't perform anything on them. All right, tinea pedis. So this is ringworm of the feet. A lot of us probably had this when we were little kids. You do get this from running around in the water or running around without shoes on or going to public pools, which I'm sure most of us did when we were kids. But yep, so it's the exact same thing. So we have ringworm, it's just infecting the feet. And actually, ringworm, they're not really showing it in any of these photos, but ringworm can look like an actual ring, and that is where it gets its name from. But it is very itchy, it's very uncomfortable, peeling, blistering when it takes place on the skin. And we would not be able to perform service on this individual either. All right, so we have paronychia or felon. So this is inflammation or skin, inflammation of skin around the nail. So yeah, typically this can happen when you get a cut on your nail or your nail is damaged very bad, and then it ends up getting infected. So this is typically a bacterial infection, or it could be a disease-related condition of the tissue. But I have definitely seen this before, actually, on a lady that I worked with, and hers had completely eaten all the way through the side of her nail because she let it go for too long. If this ever happens to you or you notice this on the client, they need to go to the doctor right away. Don't forget that our hands are actually a lot more susceptible than we think they are. I know that our skin on our hands is typically a little bit rougher. We're supposed to use them. That is what they're for. But when damage occurs on the nails and when they're left open, when the skin itself is left like open, it's very susceptible to disease. So you have to be careful. So you do not want to work on this person if they come into your salon or your spa either. All right. So oh my gosh, onychoptosis. Thank you. Onychoptosis. So shedding or falling off of the nails. This could be due to a couple different things, not just a couple, like a lot of different things. A disease could typically, like an underlying disease could be causing this, poor blood circulation, things like that. So if the problem is solved, then the nail is able to regrow, but if it goes untreated, then you might not, if the injury or the disease just continues to get worse, then you might end up not really being able to grow your nails anymore. But your nail bed is going to be really sensitive, obviously, because your nails are falling off. And then that skin under there is not supposed to be left open and exposed, so it's very painful. I don't know if anyone here has ever had a nail fall off. I have not, but I certainly have had where my nail got a little too short. That's never good. All right, so we would not be able to work on this individual. We could cause them way too much pain and discomfort, and then they would be more apt to receive infection. All right, and then we just have our regular onychia, inflammation of the nail matrix. This is caused by a bacterial infection, or it could also be, again, disease related. I've also had this before and it hurts so bad. Oh my gosh, it looked just like that. I don't know why I got it, how I got it. I actually at the time didn't even have any injury or any open wounds or anything on my hands, but somehow I managed to get that. It's very uncomfortable. But basically, so your nail matrix gets inflamed. So it does occur around this part of your nail where the nail is coming out, right? So our nail matrix. And then you'll notice pus forming. So that's what this is on this photo. All of that yellow stuff is dried pus. And then you'll notice here as well, if you look really close in this photo, the skin, that first layer of skin is actually coming off. It's being eaten away. And then we also have a lot of swelling occurring. So we've got that like tension, it dries the skin out. So it's very, very painful. We would not be able to work on this person either. Okay. So now we have blue nails. So blue nails, we see these more often than not in your elderly people. So the nail actually does appear sort of bluish and it looks like a bruise underneath the skin. And essentially it kind of is. Uh, but you see this a lot in systemic problems of the heart or like poor circulation or nail injury. Um, and the reason why this appears in people with heart problems, if they have like a heart, um, oh my gosh, what is it in particular? Chronic like heart failure. Um, it you can end up the person can end up sort of pumping blood into other places of their body. My grandfather actually did have that, so it's pretty crazy. He did have this going on his nails. So yeah, that's pretty much what that is. So we would be able to work on this person. This is not contagious. This is something that's just kind of happening secondary. Guys, hold on just 1 second. Okay, that's okay. Okay, eggshell nails. So these are very soft and very, very thin nails. You have to be so careful. And we were talking earlier about the drill, when we use the drill too hard and you end up getting that burn or bruise or what have you on your nail. People with eggshell nails are extremely susceptible to that. I mean, you are very likely to receive those types of burns, even if your nail tech is doing what they should be doing. It's just very easy because the nail itself is not healthy and it doesn't have as many layers as your nail ought to. This is due really just to hereditary. This is nervous condition. By that, we mean like anxiety, depression. This is associated closely with that. But I find that it has more to do with your just being hereditary. My mom does have nails like that, and unfortunately, I did get them. I wouldn't say that mine are a very like a 100% true eggshell nail, but they're definitely really, they break. They're not strong. All right, so you could work on this person, but they are not ideal to have acrylics or anything like that. You would just want to keep them with like a natural nail manicure or pedicure. All right, so corrugations, injury or systemic conditions, uneven growth. So these are going to be horizontal, wavy. These nails have horizontal, wavy ridges over them. I think that this is a little bit fuzzy, but if you look, you can see that there is a ridge that's going all the way across. Yeah, easily recognizable, definitely. So you can still work on this person. This is not something that's going to be contagious. It has to do with underlying conditions. All right, here we go. Coleonychia or spoon nails. I have never seen this on a young person before. This is something that does start to happen when you get a little bit older and your nails do get this really different looking concave shape or spoon shape. You have to imagine that these are pretty painful and they are not really adhered onto the nail bed all that well. So this is usually due to something systemic. It could just be age. You know, everyone knows as we get a little bit older, our body doesn't process nutrients as well as we would like for it to. So you're more susceptible to having conditions like this. And the nails are always the first thing to get affected. Yeah, unlikely to disappear. Yeah, that's true. Once this happens, it's just kind of is. Okay, so this is making me not like hands and feet even more. I'm sorry, Joseph. I know it is really scary. Actually, I'll never forget my very first nail client that I ever had when I was in cosmetology school had super thick nails. I feel like she definitely had a fungus, but my educator told me how to do it. Can you imagine? Horrible. So my dad was in his early 40s when I noticed them, and when I look at them, they look flat and almost curved up. Yeah, so you know, that could just be an underlying condition. It could be from many different things, be it like an autoimmune disease or maybe, yeah, you're good. Thank you. Um, I lost my train of thought. Darn it, Hunter. Okay, so yeah, anyway, moving on. I forgot what I was saying, you guys. I'm sorry. I'll go back to it. Oh, okay. So that could be due to a number of different things, underlying conditions like, diabetes or what have you. He thought it was because he uses his hands so much, because he's always working. He also could have damaged his matrix or his nail bed. It could have happened, but it could just be due to age. All right, so furrows. I've definitely had a furrow before, and I thought it was going to be there forever, and it wasn't. It did grow out, and I don't know what it came from. But so this is an indented vertical line. So like our previous, we had horizontal lines. This one just happens to grow vertically. So injury to the matrix that causes cells to reproduce unevenly. It could be nutrition related. It could be due to an injury, or it could be due to an illness, pushing too hard with a pusher during nail services, or exposure to harsh chemicals. So this is something that as a nail tech or a cosmetologist, you could actually cause. So don't forget that, like, we can actually cause harm to our clients as well. If we're pushing too hard, if we're clipping too close to the skin, or if we're really just not doing a thorough enough consultation and we're working on clients that we shouldn't be working on. So we do have to gotta know our stuff. So for these nails, only natural nails, you wanna just lightly buff them, apply a base coat, the whole 9 yards. All right, so then we have this fun one. I always have a hard time. Okay, onychogryposis. Yes, increased curvature of the nails. I think all of us have seen this on elderly folks as well, where the nail turns into what is almost not even a nail-like substance anymore, and it just starts growing off. It almost looks like a extra extension. So this is when you get over thickening of the nails. And earlier when I was talking about that YouTuber that does medical treatments, he's like a medical nail tech. He works on nails like this a lot. Yeah, so with this, we do have increased thickness, and curving of the nail may occur with age or injury, of course. All of your nail disease, they can all be caused by injury, underlying diseases. It's all right. It's all very general. All right, so look for signs of infection, because these are very prone to infection, of course. Again, notice that we are sort of defying the nail bed here. So bacteria, everything is able to get underneath the nail and go in. Ugh. Okay, so here we go again. Onychocryptosis. Ingrown nails. So this we're very familiar with. This could be caused by environmental causes or poor nail trimming practices. Maybe you trim a little bit too far over, and then you actually damage your nail. Or if you trim like way too far, then you're giving your nail a little bit too much room to grow as it wants to. So you could cause it to grow more that way. So if the nail grows into the edge of the nail groove, cutting the skin, or becomes deeply embedded or infected, we need to refer them to a physician. So that is something that your clients with ingrown nails is going to be prone to, is this, getting that infection. Notice that the nail over here is kind of cutting into the skin. It's not good. It's like just having a little open wound. So you can still work on this person, but you would have to stay away from this. If it were me and it were my call, I would not work on a client like that. I would tell them to go see a doctor. But if it's just a regular ingrown nail and you don't notice any redness or swelling or anything, then it should be fine. All right. So then there's melanonychia, brown or black darkening of the nail. So this is due just to an increased production of melanin. And you do notice this with your darker skin tones. You just have an increase of melanin, so it's more likely to make its way into your nails. But yeah, so it's that increased production of melanin by melanocytes in nail matrix due to trauma. Yep, so systemic diseases and especially medication could cause that. Just your melanin just starts kind of going into your nails a little bit more, and then you'll notice that it's just a slight darkening. So it's nothing life-threatening or anything that you wouldn't be able to work in on the salon. We just have increased melanin in the nail. All right, and then we have onychoxis. thickening of nail plates, or an abnormal outgrowth of the nail. Very easy to recognize and likely to disappear. This is something that could happen like the rest of them for a million and one reasons. This could also, when you see this happening, fungus could be involved in that. Thickening of the nails always makes me really nervous because more often than not, that thickening is because of that, that fungus that we find in there. All right, so agnails or hangnails, we all get those and they always hurt and they're terrible. And then you have those people on the internet that like to make those little cartoons of them going all the way down. Terrible. So yeah, we can lightly trim these. You can actually use your little cuticle nippers to get them. Just make sure that you're not getting too close, okay? You don't want to go all the way down to the living skin. You just want to lightly trim it just to make it less likely for that person to actually catch it on something and then rip it further. Yeah, so this heals 2 to 3 days. And I'm sure that all of us are experiencing in Erica, I just saw this. I'm really glad I'm not eating right now. Yeah, now's not a good time to eat, probably. Sorry, guys. But yeah, hangnails, all of us are probably noticing that because of how much we're washing our hands during quarantine. I know that my nails are, or not even just my nails, but my hands are like, feel like rhino skin. All right, then we have our bruised nails or splinter hemorrhages. So this one, our bruised nails are very similar to blue nails. The main difference here is that a bruised nail is not caused by any underlying heart conditions. Can they look exactly the same? Yes. But when you see a bruised nail, usually on somebody who's a little bit younger, it's probably not due to a heart condition. Doesn't mean it can't be, but it's probably not. Yeah, so this is due to trauma to the nail. That happened to me one time when I was in school. I dropped a textbook on my toenail and I just had that there for like a year. It was horrible. Of course, it has to hit like right at the matrix. Their breakfast everybody said that she could. Oh no, I'm sorry. I didn't mean to ruin your daughter's breakfast. All right, and then we have leukonychia. That's white spots appearing on the nail. This is typically due to separation of the nail bed. It looks like maybe you buffed it a little bit too hard. You could get what looks exactly the same by doing that. If you were to just the other Kylie. Oh yeah, Kylie grossed out Kylie. So yeah, the white spots, you could certainly cause this by accidentally hitting the nail with a drill, or maybe you filed too hard, something like that. But the true leukonychia is either due to something hereditary, or your nail just starts separating from the nail bed, and it looks white because it's popping up off of the skin, and that underlying skin is what gives this nail that sort of pink color. Right, so when it's not really touching it anymore, it's just going to look a little bit more, I guess, opaque, a little whiter, looks spotty. Then we have pterygium. That is when the living skin that becomes attached to the nail plate. So your hyponychium, it is just attached and it just continues to grow with your nail. Says that this is due to severe injury to the eponychium or the hyponychium, but that's not always the case. In fact, when you have acrylics on, you can get something that works just a little bit similar. Like the longer your nails are, the longer your hyponychium has a tendency to be, because it has more room to continue growing, so it's going to. And then you can notice that your hyponychium will actually grow out pretty long, and then it just starts peeling off a little bit, and it looks exactly like that. You have to be careful when you're trimming those nails because that skin is still attached, and you could cut your client and they could bleed. So yeah, if severe, refer the client to a physician, but it's really not a big deal. You just have to be careful and make sure that you're not going to cut into that skin. Bose lines, we don't have a picture here, but so the identifier, indentation similar to horizontal corrugations that runs across the nails. Earlier when we were noticing those horizontal or those vertical lines happening, typically that's due to either age, hereditary, it could be hereditary, or it could be nutritional It's pretty common to see that if someone has poor nutrition, you get lines in those nails. All right, so onychography, bitten nails. Who bites their nails? I know we have nail biters. Don't bite your nails, it's so bad for you. Your mouth is a very dirty place. And when you're biting your nails a lot, you can actually, obviously, you can hurt your nail, you can leave it open to bacteria. And then when we're putting our hands in our mouth, which is a very bacteria ridden environment, yeah, Joseph, you're more susceptible to either disease or infection. So you got to get some of that stuff to put on there so that you stop biting your nails. All right, and then we have onychorhexis, which is split or brittle nails. Yucky. So injury, improper filing, harsh chemical contact. So this is every time we get our acrylics taken off after we've had them for a long time, we have this. We are suffering from onychorhexis. We've got those split brittle nails. I just got over that from when I got my acrylics off. Now you just pick at your nails. Picking at your nails is also kind of bad. We want to be nice to our nails. You know, I say that, but my nails are pretty nasty. Yeah, when I got my acrylics taken off, I felt like my nails were just, I mean, they were breaking about halfway up. It was pretty painful. That's not good. Totally my fault though, because I let them go for way too long and then just started like slowly taking them off myself at home. Don't do that. I don't recommend that. All right. So here we go. Giving you guys the answers. So the cuticle is dead tissue around the nail. That is true. So while the cuticle is dead, please don't forget that your cuticle is attached to living skin. So there's a cutoff point, and you have to be careful not to overdo or overshoot that cutoff point. So only cut the skin that is dead, and you will know that it's dead because it's going to be more of like it's going to be dry. It's going to have like a flaky texture to it, and it will not be as transparent as the living skin. All right, so then we have, so true or false, if nail conditions are present, a service can be performed without modifications. True. A service can be performed with modification. Oh, yeah, I'm sorry. Service can be performed with modifications. I was like, what? Yes, you can. So not all nail conditions are contagious. It's those funguses, those bacterial infections. When you see any signs of swelling or infection, that's when we're not able to work on them. But if they just come in, they've got some Bose line, things like that, it's fine. Same, I would have gotten them off, but because of Corona, I had to take them off myself. Yeah, I know. A lot of us are really struggling with those acrylic nails. I feel like I got mine off just in time before that could have been. You know, I guess it wouldn't have mattered because I'm taking them off myself anyway. Still. All right, the lanula is the visible part of the matrix. So that's going to be the lanula. It's the visible part. So that's like, can't see them as well on females, but they tend to be a little easier to see on males, but it's that part down there. The nail plate is made of cells that have keratinized. Exactly. So just like our hair, they have keratinized, they've grown out of our body, come together and harden to create that or this. I mean, even our hair is soft, but on more of like a microscopic level, it is kind of a harder substance. That's why when we take our hair and we rub it together, we can hear that like, because hair is not really soft. It can feel like it, but it's not. All right, so cell production in the matrix determines the thinness or thickness of the nail plate. Yep, it totally does. Hence, that's why they have deduced that when you get that thickening of the nails, something is going on inside of your matrix that's causing it to overact. And it could just be due to old age, injury, all that good stuff. So for a new fingernail to grow, it takes approximately 4 to 6 months. And then if it's a toenail, it takes approximately 12 to 18. So your toenails are always going to take longer. If a nail disease is present, the client can be referred to a physician, totally. In fact, I would just say that every time just to make sure that you're covered. Hey, you know, that kind of looks like this to me. It looks like it. I don't know. I'm not a doctor. You know, you get that. You'll get your script. So a healthy nail is smooth, curved, and without hollows or wavy ridges. Exactly. And then a bacterial infection around the nail is paronychia. Yep. So that's an important one. It's very common, just paronychia, bacterial infection. Eggshell nails are thin and can be hereditary. So what that one said. All right, good. So then the final one that we are, oh, actually, hold on. I wanted to show you guys. We'll move into nail shapes in just a second, but let's look at a couple more fungal infections. So nail fungus. Okay. So earlier when I was talking about a chalky texture, that's what I mean. So if you were to actually take a file to this, it would just start turning into powder. And it's like a different, thicker powder because, you know, we know that we have, obviously it's our nails, we just have like powder, but it just comes off like sand. Like, have you ever seen that kinetic sand that they sell at Michael's where you can make like the little, I guess like castles and stuff out of them? It's just like a toy for kids. That is the texture that it is. Yeah, so it's like it's pretty nasty. Yep, and then some funguses, so if you let it go unchecked, it can end up actually eating its way all the way into your nail bed. I have seen this before, but notice how that nail is getting thinner and thinner and it's coming away from the skin. This is awful. This person should have gone to the doctor a long time ago. And then sometimes, depending on the fungus that they have, it can be black. Nail fungus can absolutely be black, so don't confuse that with blue nails. The main difference is that your blue nails or just your bruised nail, it's going to look like a pretty clean bruise. You're not going to have everything else that comes with it like you do in the fungus where it looks super chalky or it's got that really white look about it or very yellow. If the darkness on the nail is accompanied by all of that yellowing or the whitening and thickening, then it's a fungus, like definitely. Oh my Lord. Oh my God. It's so bad. You guys, I am so sorry to even show that to you, but you gotta be you gotta be careful. Oh, it's so bad. Okay. Yep, so here we go. We have the candidal infection, and candida is just that typical fungus. It actually just lives on your body, on and in your body naturally, but if you get an injury and you create an environment for it to just go wild, then it can. So here's our white superficial infection. That's it's just a different type of fungal infection. There are different types of funguses that go a little bit crazy, and then as the infection gets a little bit worse, then you can notice worsening. But yeah, so it can look real speckly like that, really white. It can look a little bit like hollow like that. It looks like there's tearing of the nail up towards the free edge, the free edge of the nail, and that's just because it's sort of crumbling away. And then you just have this one. This looks like sort of the beginning of a bad fungal infection to me. And then this is if your fungal infection had moved on to your feet. So this would be like our athlete's foot. Yeah, funguses they are so common, you guys. I mean, you know, I hate to say it, but we do, yeah, moon sand. That's what it's called, moon sand. Thank you. Yeah, I've also noticed that, guys. I'm sorry. I think my screen is definitely lagging for some reason. I'm not sure why. The connection is weird in here today, I guess. But yeah, these types of clients, fungus is so common. It is probably the most common condition that you're going to see when you're in the salon. And I mean, even here, you know, even on the salon floor here at Sunstate Academy, I mean, we get fungal infections all the time, and we just have to tell them, you know, unfortunately, I suspect that you could have a fungus, so we'll need you to go to a doctor. Just get it checked out. If it's nothing, then you can just bring us back a doctor's note, and then we're happy to work on you. It's usually what we say. I always wondered what athlete's foot looked like. I heard of it, but never knew what it looked like. I thought it was below the foot, like you walk on. Oh yeah, athlete's foot is pretty intense. There we go. Yeah. So athlete's foot can take a lot of different forms. Um, it can get that like that white or yellowing to it, and then the redness that you're seeing there, this is when that skin finally splits open and you're seeing a bunch of raw skin, possibly some bleeding underneath. But yeah, it's just a bacteria that got into the skin on your foot and it just goes crazy. Mm-hmm. It's pretty, yeah, pretty intense. Okay. So perfect. Then let's move on to our natural nails, the 113.2. This one's going to be a little less shocking. You can eat now. All right. So what do you think are some of the most enjoyable things about getting a manicure or a pedicure? So I'll let you guys use the chat for that while I take a sip of my Dr. Pepper, if you don't mind, because they were out of Diet Coke today. All right. So being pampered, the massage at the end, it's relaxing. Yeah. So definitely, a lot of people really enjoy getting a manicure or pedicure. They like to be, yeah, the massage. They like to be pampered, and exactly. Especially, I think the massage. I think it matters more when, okay, the hot wax, but like the paraffin wax. Yeah, the paraffin wax is really nice. It always leaves your skin really soft afterwards. But yeah, that's exactly right. You know, people do like to feel pampered, especially our feet because we're on them so often, especially us because we're on our feet so much. It's just occupational hazard. It's just a part of it. It is a part of this life. Yeah. And then some of us just really don't like our feet touched, and that's okay. Am I moving backwards? No. Oh my God. I'm sorry, I'm losing control. Okay. So basic manicure. So a manicure is the cosmetic care of the hands and fingernails. We know that. We know that. All right, so let's talk about some basic nail shapes. So square is a very common nail shape. I'm gonna just take a leap and say that this is the most common nail shape. In general, this pretty much looks good on everybody, and it makes your nails look stronger. It just gives it that square, very foundational look. If somebody has very, I guess, really thin nails, square might be a little difficult for them to have because those edges are not going to want to stay. So like eggshell nails would probably like go inwards. So you can't use the square on every single person, but it's very common. And especially in acrylic nails, it's like square all the time, except for within the last couple of years where, I mean, the art of the nail tech is just really taking off and we are seeing some really cool nail art happening. I just think it is so cool. All right, then we have squoval. So this is right in the middle between square and oval. You have your squoval. This one's also extremely common, oh my God, common combination of square and oval. So this is also known as the soft square or the rounded square. All right, so then we have oval. This one is tapered and round at the tip. And then just our regular round. So your oval, just like our face shapes, it's round, but it's more elongated. So that's the difference. And then there's pointed. So this is coming into style recently. We like our very pointed nails, and you could do just like a light point, just like this one, so where it still looks a little bit natural, or you could do a straight on like claw, or like a, not a claw, but like a talon. I love those. They look so cool. Yeah, and those are typically worn longer as well. All right, so then we have our basic pedicure. A pedicure is the cosmetic care of the feet and toenails. I'm just not a feet person. I'm just not. That's just me. Lots of people are feet people, and thank God there are feet people out there because we need you. But I happen to not be one of them. All right, so benefits of a foot massage. There are so many benefits to a foot massage. So we have increased circulation of blood supply to the skin, tighter, firmer muscles, stimulation of glandular activities in the skin. You'll notice stronger muscle tissue, pain relief, improved texture of the skin, and relief of emotional stress and body tension, most importantly. So something that you will notice is that the vast majority of people that come in and receive pedicures, they are a little bit older. You don't notice the youth coming in as often to receive pedicures because they don't have those needs just yet. We're a little bit more concerned with our nails up here that everyone can see all the time. As you age, you start having other reasons to go and get them, especially if you are a person that can't really take care of yourself anymore. You notice less blood supply happening in your legs and in your feet. And then that can really affect your toenails, and then you can end up with all of those underlying conditions. You're more susceptible to funguses of the nails, bacterial infections. So as you age, it is so important to take care of your feet. It really is. You have to keep them moisturized, make sure that your nails are staying healthy and that you are getting that blood supply. So it's very imperative that that person is getting that massage. So it's actually a lot more important than we give it credit for sometimes. All right, so 5 basic massage techniques. So we have our effleurage, petrissage, and I think that I think you guys are probably familiar with these techniques. I think so. I think we learned about this a little bit in intro. Sorry, I can hear somebody walking in here. They turned. Never mind. We're good. All right. So effleurage. So that is the light stroking, circular movement. So it's more of like a wax on situation. Then we have petrissage, light or heavy kneading, pinching, rolling of the muscles. Right? No, so that's Tapotement. I'm sorry. So that situation. Okay. Friction, circular or ringing movement with no gliding. So there's no gliding involved in it. It's just, yeah. Tapotement, there we go. So that's our tapotement that we have. It's also called percussion, so light tapping or slapping movements. We do that on the face a lot to help with that lymphatic drainage over here. Increased blood circulation helps skin release carbon dioxide buildup and waste material, but believe it or not, that does actually happen in our skin, in our feet, and in our hands. We do get waste buildup. So tapotement is the most stimulating massage movement. Then we have vibration. So shaking movement, very stimulating, and it's only done for a short amount of time. And then we usually use like a tool for that. It's very hard to get like a vibrational movement yourself. All right, so important massage points. So we always want to check for conditions. So that means if we're about to do a hand massage, we want to make sure that they don't have any like open sores or anything on their hands. You'll have clients that come in and they have eczema. Eczema is not something that will keep you from doing a massage on somebody, but you do want to just make sure that maybe they're not in the middle of having like a flare up. You could, yeah, cause them a little bit more pain than they're currently in. If they're noticing like splitting open of the skin, if there's some bleeding going on, it might not be a good time to do a massage because that's going to stimulate the area. We just got to be careful. All right, then avoid massage that is too deep, too aggressive, or too lengthy. So we're not trying to hurt anybody. If somebody tells you you're about to do a pedicure for them and someone tells you, I have really sensitive feet, you probably don't want to get in there and just wham down on the foot because they'll kick you. All right, provide an even tempo or rhythm to ensure relaxation. So what that means is you don't want to switch it up too much. There's absolutely nothing relaxing whatsoever about like performing a massage on someone and then you're switching up the rhythm like it's a mixtape, you know. It's just you have this and then that and then all of a sudden it's just going really slow and then like boom, you're onto something else. You don't want to confuse them. Keep it relaxing. So avoid removing hands from the body once the massage has began. That can also be very confusing if you're constantly taking your hands off. Then that person is going to start feeling awkward because they're not going to know when you're done or not. That's one of those things that gets overlooked pretty often. But once you've started a massage, don't take your hand off. And if you have to, make sure that your other hand is on it. So for instance, we've got our, diet Dr. Pepper here. Ever Dr. Pepper here. So, you know, if you're massaging like the face, then, or I'm sorry, not the face, if you're massaging the hands or the foot or anything like that, and then you have to like take your hand off of it, then just one at a time. That's it. And then if you need to move this one, place this hand where it's supposed to be, and then you can remove this one. But don't like constantly take your hands off of it all the time. You're gonna ruin the whole thing. All right, so use feather-like movements to remove the hands. That's a very broad statement. Use feather-like movements to remove the hand, remove the hand. So what that means is that like when you're supposed to close out a massage. So you don't want to, you know, be here massaging your client and then all of a sudden you're just done. How was that? That was great. You kind of have to ease your way out of it just a little bit. So like when you're closing up your massage, maybe end it in like an elongating. That's always what I did. Like if it was a hand massage, I would always end up just, these were like the last few movements that I would do. And then I would close it up just like that. And then, well, thank you so much. Yeah, so keep the connection, don't disconnect. Yep, exactly. So like keep your hands on them, but remove slowly and still have the other hand on them. One of the nail techs taught me that. I forgot how she said. Yeah, exactly. So you don't want to lose that disconnection. You can actually start stressing your, like low key stressing your client out by coming away from them too much. Then they don't know when it's really going to be over. It gets awkward. One of those little details. All right, so specialty nail services, reflexology, aromatherapy, paraffin treatment, French manicure, no chip polish, and nail designs. All right, so reflexology. So this is an intentional massage method. It's used on specific pressure points or specific points on the hands and feet, sometimes even the ears. Honestly, you could do this all over the entire body, but it relieves tension and it can help out with certain conditions that you have, especially the buildup of those toxins that we were talking about a little bit earlier. Reflexology focuses a lot on that. So aromatherapy, the controlled use of essential oils that are highly fragranced or specific outcomes. I think I did tell you guys this previously. I did go to Aveda and they focused a lot on aromatherapy. Aromatherapy was part of pretty much every service in the Aveda world. They called it a sensory journey. All right, the paraffin treatment. So paraffin it's a moisturizing wax that is used on the hands and the feet. So for those who have not ever had that, typically what you do is you have these little bags and you'll take your melted paraffin wax, put it in the bag, and then you put the person's hand or foot inside of that bag and you let it sit for like anywhere from 10 to 20 minutes because it really just depends on the product. And once it dries, then you can peel it off. Now, it doesn't set up super hard like a candle wax. It's going to be a little bit more, I mean, it can set up really hard like that, but usually you can just kind of like rip it off. It's in such a thin layer that it's not like your hands are going to get stuck in there like a statue. It's the weirdest feeling ever, but it feels so good at the same time once it comes out. Yeah, it does. It feels really weird and a little uncomfortable when your hands and your feet are in there, but once you have it off, you're like so moisturized. Everything feels great. All right, the French manicure, in my opinion, is the hardest manicure to achieve because you do have to get that perfect little white edge. Notice how if we're doing it just ridiculously professionally, then you're going to have those tapered little sides over there, and then it gets thicker. Yeah, so French polish is the style used to polish a nails, creating a natural looking effect. So you're making it look like you have this super healthy free edge and then these cute little like skin colored or nude nails everywhere else. So difficult, and those are the pickiest clients. I will tell you right now, anybody that comes in and asks for a French manicure, they're going to put you through the ringer. All right, so then we have our no chip polish, otherwise known as our gel polish. I'm sure we're all familiar with that. I do love gel polish. One of the good things about it is that your manicure is actually going to last for 2 weeks or longer, as opposed to the traditional nail polish that you have. The other thing that it does not do is that it does not turn yellow. I'm sure we've all noticed before, maybe not all of us, but most of us, that our regular nail polish, just the type that we've always used, right? You have to wait for it to dry and everything. After a couple of days, it starts changing color. You ever had that moment where you're like, I don't really remember this looking like that shade, or like this looks different? It does kind of yellow out over time. But your gel polish does not do that. It stays true to color and it does not chip if it's done properly. So yeah, typically lasts 2 weeks, could last even longer than that. You do have to use an LED or a UV light to cure each layer. So you'll apply a layer of gel, have your client put their hand in that little LED or UV light and wait for it to dry. It's usually about 30 seconds. Sometimes 30 seconds to a minute, depending. And it is removed by soaking in an acetone-based product, or you can just drill it off. Drilling it off is the easiest way. With certain gel polishes, there's no way. Even the acetone, it just does not come off. Or if it does, it's going to take like a little piece of your nail with it. All right, so the nail designs. They're a way to add a special touch. We know that. So this is very in right now. What is that? Is that a cherry blossom? Yeah, she's got a little cherry blossom there on her nails. It's very cute. Oh, I love that. Awesome. Okay, so true or false? Round shaped nails are the most common for men. That is true. I will say yes. I don't think I've ever come across a man that had square nails. Unless it was, intentional. If they had like fake nails on, then yeah, but for the most part, I don't think I've ever, at least that's just me. Yeah, I would say round are definitely the most common for men. So true or false, paraffin is a type of wax used to soothe the hands and feet. That is true, and it feels crazy, but it does a lot of great work for the skin. So use caution while massaging clients with prominent varicose veins. Yes, we have to be careful with varicose veins. We don't want to put too much pressure on them at all, because you can actually make that condition a little bit worse and you can kind of hurt your client. So the massage movement most commonly used to begin and end the massage is effleurage, and the most stimulating massage movement is tapotement. So that's like the tapping or the slapping. So a type of massage that utilizes pressure on certain points of the hands, feet, and ears is reflexology. No chip polishes utilizes an LED or UV light. So a special touch can be added to a nail service with a nail design. And French polish creates a natural look. Also, our no chip polish typically lasts about 2 weeks. There we go. All right, perfect. Yeah, so those aren't terribly complicated sections. Thank you. Geez, we're gonna get it today. I haven't had my coffee this morning, you guys. I went to Starbucks and they gave me somebody else's drink on accident. And of course, it had to be something nasty, totally undrinkable. All right, so I found this on the interwebs for you guys. So here are some other nail shapes that we can have. So we have our oval. Here's our stiletto nail. So that's the variation of the oval nail that we were talking about earlier, or our almond shaped nail. It's just even pointier. So it's longer, a little bit pointier. It looks like the stiletto part of a shoe, or the heel part of a stiletto, the heel stiletto part of a shoe. Get it together, come on. Okay, lipstick and cutout are just annoying. Where's it? Lipstick and cutout are just annoying. Yeah. Yeah. I like this shape. I like this shape a lot. I don't know how much I like it on a nail. I like this on hair because it looks like Powerline from a Goofy movie. Reminds me of a couple different things, but for nail, I will tell you that the longer the nail is and the more unnatural the shape of a nail is, the less time that person's going to be able to actually wear that nail, because they are just not practical. At the end of the day, it just isn't practical. If we're like foundationally speaking, your stiletto nails, your lipstick nails, the pointed cutout, your edge, the trapeze, the stiletto square. These are all so prone to breakage because of how long they are, and because of just the shape. It's tapered off into something that is not strong. The point is just the aesthetic of it. It's not created to to work for you. You know, yeah. As opposed to your oval, which has a better structure. Your almond has better structure, certainly round, and then square is very structural. Actually, my best friend had stiletto nails last month, and she had them for about 2 days. Hers were the really, really long ones, and she pays a lot of money for these nails. The guy that does them just does a gorgeous job. I mean, he's a total artist, but she broke it off and it went all the way down past her hyponychium. Ooh, you guys, I like almost fainted when she sent me that picture. Like, nobody asked you to send me that picture. Why did you do that? All right. So then moving on, yeah, our cutout is a very interesting shape. So the edge looks a little bit more like a spear. You'll notice that it's a square shape that all of a sudden moves into a very pointy, like a pencil shape. So Erica, I don't understand how people would use their nails like that. It would drive me crazy. It's hard. It's like you have to change every part of your life if you're going to have really, I guess, artistic nails like that. You live your life around those nails. It's so true. And another thing I don't get is how at the nail at the top right, they would get the curve in the middle. Oh, you would probably have to do this with a drill. That would be very difficult to do with a file. You would have to get that like that round bit in there with like a drill. Let me show you what I mean. Let's go back to athlete's foot. Sorry. I'll drill bit. There we go. So you would just have to place it. Oh, it went. I'm sorry, guys. I didn't think it was going to load. Yep. Only smooth. So you probably wouldn't use this one because it's rigid, but if it had like the smoothness over it, that's the shape that you would probably use. You would just go like right onto the nail to get that shape. It is. It's definitely complicated. And as the nail tech, I think I would be really stressing out that those nails were going to bust when I was trying to put that shape in there. Probably more so than any of these other ones. Very time consuming, yeah. Let's see, squivel. Okay, and then here's the ballerina coffin. That is my favorite shape. I love it's either called a ballerina nail or a ballerina shoe nail or a coffin nail, depending on which aesthetic you adhere to. Some people see a coffin when they look at this, and some people see a ballet shoe. Which type of person are you? But this, I love this shape a lot. When I do have acrylics on, this is the shape that I always go for. I just like it. Now the trapeze nail, I have the most difficulty with wrapping my head around, probably even more so the cutout or the lipstick. The fan nail interests me a lot. And we don't see this shape very often, only sometimes. And that's that on that. No, really, I mean, I know I say this all the time. I'm all about individuality. You do you. I'm into it. I wouldn't be able to handle that nail. Like picking things up would just be so difficult. They look like they got flat. They do. They kind of look like they just got like, I don't know, flattened out a little bit. But still, you know, you gotta give credit where credit is due. Sorry, I just had to see who was on this. Oh, it's Justin Timberlake. Okay. All right. So anyways, guys, does anybody have any questions about any of that for me? So those are the two that we're going to go over today, just point one and then point two. And I did send an email out to everybody yesterday that Thursday's meeting is canceled. We are doing, Mr. Brandon Dixon let us know last week that we are actually going to be doing some professional development for the faculty. So we won't be able to touch base this Thursday. So the next time we're meeting is next Tuesday. And then I'll send out, you know, your guys' link and everything. Did anybody have a chance to check and see if they received that survey link that I resent? Okay, perfect, good. Yeah, this time I didn't click the copy button this time. I just did the traditional highlight, copy, paste. Yes, okay, good. All right, good. Well then, yeah, if you guys got it, I assume everybody else did this time. Something's going on with that copy paste, I'm telling you guys. All right, wonderful. So then, yeah, any questions in general for me? I'll give you guys a moment. Okay. Yeah, Summer, you can use the mic.
Okay, so when I try to upload my work, like to send it to you to share it to you for my YouTube, it keeps like flashing. Like the screen itself on YouTube keeps flashing and like won't let me like click share and stuff. So I sent you a video of it doing it, and it's been doing it for like the past 4 days, and I even like undownloaded the app, turned off my phone, like I don't know what's going on with it, but like it just will not let me share it. Like it won't let me even like click the button. But I can upload them.
Sorry, go ahead.
I can upload them easy. It's just I don't know why, but it just keeps flashing. Like even when they're uploading, the screen's flashing.
Okay. And you verified your YouTube account, right?
Yeah, no, I've already sent you stuff before.
That is very weird.
Yeah, like I sent you a screen video of it doing it. Like it's not on my phone. It's not like that during like any other apps or anything. It's just.
Gotcha. All right. So then let me do some troubleshooting, see if I can figure out what that is. And you said that you sent me a video of it doing that weird thing.
Yeah, and I'll send you it again if you can't find the email, if it makes it easier.
Yeah, I actually haven't even had a chance to check my email yet today.
Okay, yeah, that's why a lot of my assignments aren't in because they're uploaded. It's just I can't send them like to you.
Okay.
Yeah.
All right. So then I will do that, and then I will get back to you. Thank you for letting me know, Summer.
Thank you.
Summer. Okay. Next question. So I heard they were closing all Florida schools. Is that just, honestly, I don't know. We're not part of the public school system. So yeah. Whenever we hear those, it's usually like a pretty good idea of what might end up happening, but we're not part of the public school system, so I'm not sure. But as soon as I find anything else, I'll let you guys know. Honestly, how do I do a scalp treatment on my mannequin? So a scalp treatment on your mannequin, actually there is a video in Pivot Point. I think if you type in scalp treatment, there should just be a video, and I'm pretty sure there's one that they use on a mannequin. But just to apply it almost like a color retouch, and you can just use conditioner, so you don't have to, or whatever you have, whatever product you have. And then just apply it to the scalp, and that's it. You don't have to let it sit the 50 minutes. It's mostly just the motions of going through and doing the scalp treatment. Okay, and then I wasn't sure if that was the meeting for you guys. I'm trying to figure out school is going to be closed for the rest of the year or not. Oh, you mean the professional development? No. It's like a training, like for faculty members, educational training, things like that. Okay, perfect. You got the link to the email. And then Joseph, yeah, definitely. So if you want to just stick around after we're all done here, and then we can talk. Okay, awesome. Well, good. So then if we don't have any more questions, if anybody doesn't have any more questions, then we're good. Then that's it. Perfect. So I will be available, you guys. If you have any other questions for me, just shoot me a message through Google Voice. You know the routine. All right. Well, thank you for joining me. I will see you guys next Tuesday, and you will hear from me throughout the week. All right. Bye, guys.